Hello all, welcome to my channel Vet Lecture. Today we will discuss multiple choice questions on veterinary anatomy and histology. Question number first. The cranial border of the ulna bear a pointed beak-like projection which hangs over its articular notch is called option A. Anconian process, options B. Acromion process, option C. Acromedian process or options D. Acrodian process. The right answer is option A, that is the Anconian process. Okay, the cranial border of the ulna that bear a pointed beak-like projection which actually hang over its articular notch. It is called Anconian process. And this Anconian process along with semilunar notch is inserted into that olecranon fossa which is present in humerus bone. Okay, and if we see that's acromion process, this acromion process actually found in scapula. This acromion process is directed downward and forward in case of cattle, and the acromion process is absent in case of a horse. Okay, and acromion process is a short and blunt, and it is extended to the level of glenoid cavity in case of a dog. And if we see that in case of pig, that acromion process is rudimentary, and in case of that rabbit, along with acromion process, there is another process which is metacromion process also presents in case of rabbit. Okay, and in case of camel, this acromion process is pointed finger like and at a true level of glenoid cavity. Okay, here are some things which we need to remember in point of view of exam point of view. We already discussed in detail such topic, but we should remember in such lines. Okay, that glenoid cavity of camel is extensive and circular. Okay, and if we see that's inferior sciatic spine which is mainly present in case of horse, while a laser sciatic spine notch is present in case is absence in case of dog. Okay, obturator foramina is a triangular in case of dog, while oval and longer in case of horse. Okay, deltoid tuberosity is actually presence on humerus. Okay, styloid process actually presents in ulna. Trochanter tertius is actually a presence on femur. Okay, phobia capitis is also presence on a head of femur. Okay, olecranon process is presence on ulna. Okay, bicipital groups is presence in humerus. Okay, Newton foramina in os causi is situated on medial border at a greater sciatic notch in case of camel, while Newton foramina of tibia is near the popliteal line in case of horse. Okay, trochanteric ridge is absent in case of femur of camel, while supracondylate fossa and trochanter tertius is absent in case of dog. If we see that shaft of fibula reach about middle of the tibia in case of a horse, and lateral and medial malleolus and popliteal line is actually related to that tibia. Okay, and the longest bone of fowl skeleton is a tibiotarsus. Patella, if we see that in case of camel, is elongated and triangular in shape, and in case of fowl, that is wide and thin in case of fowl, and long and narrow in case of dog. Okay, these are the thing which we already discussed in detail in previous video, but these are the important points which we need to remember in case of exam point of view. Question number second. The hippocampus is an important structure for the pathologist in the diagnosis of option A, distemper, options B, rabies, option C, encephalitis, options D, none. The right answer is option B, that is rabies. Okay, let's see the gross lesions which is seen in case of canine distemper. Then in case of canine distemper, the nasal and pharyngeal mucosa contain that purulent catarrhal exudate. That's a catarrhal nature. That exudate nature is a mucousy and pus like type. Okay, and in case of lungs, we found there's a bronchopneumonia. In case of skin, we see there's a fluid filled contain that pustular dermatitis. There's a vesicles. Okay, and if we see that foot pad which become very hard due to that proliferation of keratin layer of epidermis, that hyperkeratinitis we can see. Okay, and if we see that's microscopic, then there is a demyelination, there's a loss of the myelin sheath. Okay, and hemorrhage, edema, and also there is a, if we see that in case of lung, then we found there is a multinucleated giant cells we found in lungs. Okay, and in case of rabies, that negri bodies is a presence in case of hippocampus, in case of carnivorous, while this negri bodies is found in Purkinje cells in case of herbivorous. Okay, and there is also presence of a Babes nodules. Okay. Questions number 3. In fowl, four of the thoracic vertebra fuse to form a single bone, which is called option A, notarium, option B, os dorsale, option C, both A and B, options D, none. The right answer is option C, that is both A and B. Okay, in fowl, four of the thoracic vertebra, which is a fused to form a single bone, which is called notarium or os dorsale, and it is actually help brace the chest against the force which is generated by the wings. Okay. Questions number 4. The inter-transverse articulation between the last two lumbar vertebrae is found in option A, horse, option B, ox, option C, dog, options D, none. The right answer is option A, that is a horse. The inter-transverse articulation between the last two lumbar vertebra we can see in case of a horse. Okay. If we see that lumbar vertebra is mainly characterized having a long body, and there's a long transverse process which actually form the bony roof of the abdomen. Okay, and in case of fowl, this lumbar bone fused with the sacrum to form a synsacrum, and the lumbar vertebra has the following important features, just like transverse process of lumbar vertebra is long and in the form of bony plate, which is inclined cranially. Okay, and also this transverse, if we see the transverse process of first lumbar vertebra, this is shortest, and if we see that's last transverse process of last lumbar vertebra, that is narrow. Okay, a neural ring up to that third are round, and then gradually that become triangular in case of lumbar vertebra. Questions number 5. Columella is a bone which is present in the ear of option A, ox, option B, poultry, option C, dog, options D, horse. The right answer is option B, that is a poultry. Columella is a bone which is present in the ear of a poultry. Okay, in the auditory system, this columella actually contribute to hearing in case of amphibian, reptiles, and bird. This columella is nothing. It's from small. It's from thin bony structure, which is thin bony structures in the interior of the skull, and that serve the purpose of transmitting a sound from the eardrum. Okay, and it is an evolutionary homologue of the steps bone. Questions number 6. Bursa fabricus opens into option A, caprodium, options B, proctodium, option C, urodium, options D, none. The right answer is option B, that is a proctodium. Okay, the bursa of fabricus actually opens into that proctodium. Okay, and if we see that cloaca of the fowl, we found there's a three type of opening. That's a coprodium, so which actually the opening of the colon, and urodium, which is the open of the ureter. Okay, and that proctodium is a third and distal section of the avian cloaca where the bursa fabricus open. Questions number 7. In fowl, usually the non-functional ovary is option A, left, option B, right, option C, both, options D, none. The right answer is option B, that is a right ovary. Okay, in bird, non-functional ovary is right. Okay, in the bird there is only one ovary and oviduct is presence. The right set undergo degenerations. Okay, in early life, and the left sets persist throughout the life. Okay, the ovary is situated at the upper part of the abdominal cavity, just below the last two ribs. Okay, in mature stage, it is in the form of a bunch of grapes. Okay, a number of follicles of various size are attached to it by a small stack. Okay, questions number 8. The median nerves derives its fiber from option A, 8 cervicals and first thoracic, option B, 7th and 8th cervical, options C, first and second thoracic, or options D, none. The right answer is option D, that is none. Okay. If we see that brachial plexus, which actually supply nerve to the forelimbs, okay, it's actually originate from the nerve root C5 to T1. Okay, and they consist roots, trunk, divisions, and codes. And from the brachial plexus, five major nerves are arises: musculocutaneous nerves, radial and axillary nerves. Okay, ulnar nerves, and median ulnar nerves, okay, and there's a median nerves, okay. And this musculocutaneous nerves actually arises from lateral cord, that is C5 to C7 nerve roots. And if we see that radial and axillary nerves, they actually arises from posterior cords, and ulnar nerves arises from medial cord, okay. And but this median nerves is arises from all the nerves root, that is C5 to C1, okay, T1. Questions number 9. Gyri and sulci is devoid in cerebral hemisphere of option A, ox, option B, pig, option C, horse, options D, fowl. The right answer is options D, that is fowl, okay. The surface of cerebral hemisphere of the fowl doesn't contain, there's a no depressions and no convulsion, there's a no gyri and sulci, okay. But in actual cases, the normal brain, other than that fowl, mainly contain, there is a depressions and there's a convolution known as gyri, while there's a separated by a depression which is known as sulci. Questions number 10. Horn of animal is formed by option A, frontal bone, options B, occipital bone, option C, zygomatic bone, options D, premaxillary bone. The right answer is option A, that's the frontal bone, okay. Horn of animal is actually formed by frontal bone, okay. The horn is a permanent pointed projection which is located on a head of animal. It's mainly consists of a covering of a keratin and other protein which is surrounding the core of the live bone, okay. Questions number 11. The tendon of latissimus dorsi are attached to option A, teres major, options B, teres minor, option C, both A and B, options D, teres tuberosity. The right answer is option D, that is teres tuberosity. The tendon of latissimus dorsi are attached to teres tuberosity of humerus, okay. If we see that latissimus dorsi is very wide and thin muscles which is spread at the dorsal lateral aspect of the thorax and mainly help in flexing the soldier, okay. And if we see that origin of latissimus dorsi muscles, its origin from that lumbar and dorsal spine, okay. Insertion actually inserted at the teres tuberosity of humerus, okay. And the blood supply by the thoracodorsal branch of subscapular artery, intercostal and lumbar artery supply to the latissimus dorsi muscles, okay. While thoracodorsal branch which is coming from that brachial plexus actually supply to that latissimus dorsi, okay. Questions number 12. The sternum of the ox consists of sternibri. Option A, 7 sternibri. Options B, 6 sternibri. Options C, 8 sternibri. Or options D, 9 sternibri. The right answer is option A, that is 7 sternibri. The sternum of ox, horse actually consists 7 sternibri, while sternum of dog consists 8 sternibri and the sternum of pig consists 6 sternibri, okay. Let's see some other fact which is related to sternum, that sternum is a long plate that osteocartilaginous bone which is located at the midline of the floor of the thoracic cavity, and the sternum is also known as breastbone, okay. And the cranial end of the sternum also known as manubrium, it's formed by first sternum, while the caudal extremity of the sternum is formed by xiphoid cartilage, okay. In case of that fowl, sternum is known as the kill bone, okay. Questions number 13. Uh, Pterygoideus medialis is the most powerful muscles of in the ox. Option A, hearing. Options B, mastications. Option C, swallowing. Options D, vision. The right answer is option B, that is a mastication. Pterygoideus medialis is the most powerful muscles of swallowing in the ox. Okay, muscles of mastications mainly include there's a 3M, that is masseter, medial pterygoids, and mylohyoides, and 2T, that is temporal and temporalis, and there is a 1D, that is digastric, and 1L, that is lateral pterygoid. We can make a mnemonics, that's M3T2DL. Questions number 14. The lamina omasi spring from the dash curvature of the omasum in the ox. Option A, greater. Option B, lesser. Option C, median. Options D, central. The right answer is option A, that's a greater. The lamina omaci spring from the greater curvature of the omasum in case of ox. Questions number 15. The left kidney in the ox is related to which surface of the rumen? Option A lateral, option B visceral, option C dorsal, options D ventral. The right answer is option B, that is visceral. Okay, the left kidney in the ox is actually related to the visceral surface of the rumen. Okay, if we see that rumen is a big muscular elongated sac which is mainly located on the left side and in the abdominal cavity from the level of 8th rib to the pelvic inlet, and very small part of this rumen is located in the right half of the abdominal cavity. And if we see that rumen, it has two surface and two curvature and two end. The mainly two surface is parietal surface, which is also known as left surface, and there is a visceral surface. Okay, the parietal surface is a convex and is related to left abdominal wall, diaphragm, spleen, uh, while the visceral surface is related to number of structures such as omasum, abomasum, and there's a liver, intestine, pancreas, left kidney, adrenal gland, aorta, posterior vena cava, extra. Okay. Questions number 16. The parietal surface of the spleen in the ox is a convex and is related to option A heart, option B diaphragm, option C liver, option D pancreas. The right answer is option B, that is a diaphragm. Okay, that spleen is actually lymph organ. It is also that reticular systems organ, which play a very vital role in defense mechanism. Okay, situated obliquely downward and forward direction in the upper end and left part of the abdomen, between the left face of the rumen and the diaphragm. And if we see that spleen, it has also two surface, two end and two border. The two surfaces, parietal surface and visceral surface. This parietal surface is related to diaphragm, while the visceral surface is related to the left surface of the rumen. Questions number 17. The external pudic artery in the cow is commonly called dash. Option A, mammary. Option B, abdominal. Option C, femoral. Options D, sciatic. The right answer is option A, that is the mammary. Okay. The external pudic artery in the cow is commonly called mammary artery. In the cow, the udder receive blood from the mammary artery, which is actually arises from the external pudendal artery. Questions number 18. The cecum of the horse is characterized by the presence of option A longitudinal band, options B saccule, option C both A and B, options D fold. The right answer is option C, that is both A and B. Okay. The cecum of the horse is characterized by the presence of both, that is longitudinal band and saccule. Okay. Cecum of a horse is a very big, a comma shaped sac, having a base body, and there's an apex is having a capacity about 30 liter, and its length is about 1.2 meter. It is extend in a curved manner from a sublumbar regions to the xiphoid cartilage along the abdominal floor. And if we see that cecum, it has four longitudinal band and four row of sacculation. Both the ileocecal and cecocolic orifice are situated at the laser curvature at the base. Okay. Questions number 19. The third eyelid is fully developed in option A ox, option B goat, option C horse, option D poultry. The right answer is option C, that is a horse. The third eyelid, which is also known as nictitating membrane, is the fully developed in case of a horse. Okay, this nictitating membrane is nothing, is a piece of a thin T-shaped cartilage, which is enveloped by a fold of conjunctiva, actually situated at the medial angle of the eye, and the base of this third eyelid remains surrounded by a glandular tissue that is known as a harder gland or nictitating gland, and the secretion of this gland is similar to that of like lacrimal gland, like tear. Okay, in this case of bird, this membrane is very thin and semi transparent, elastic, and there's a without any cartilage, and it is attached to that inner angle of the eye and is highly movable across the surface of the eye. Okay. Questions number 20. The left extremity of the horse stomach has the form of a rounded cul-de-sac drum. The option A frenulum, option B cecus, option C cecum, option D cecus entericus. The right answer is option B, that is a cecus. Okay, the left extremity of the horse stomach has the form of a rounded cul-de-sac. which is termed as saccus. Okay, the saccus is actually a region where at the entrance of that stomach and where that esophagus open. Okay, while saccus entericus is also known as intestinal juice, is the secretion which is produced by the intestinal gland that is script of liver in duodenum. Okay, questions number 21st. The cylindrical anterior part of the penis in the dog is called option A, pars glandis, option B, pars longa glandis, option C, longa glandis, option D, pars longa. The right answer is option B, that is a pars longa glandis. Okay. In a male dog, the glans penis actually consists of two parts, that is a bulbus glandis and the pars longa glandis. The pars longa glandis is the cylindrical anterior part of the penis in the dog, while the bulbus glandis is like a posterior part and is broad in nature. Questions number 22. The entire group of the extension muscles of arm in the ox is innervated by the nerve. Option A, radial. Options B, median. Option C, ulnar. Options D, all. The right answer is option A, that is a radial nerve. Okay. The entire extension group of extensor muscles of arm, that is the extensor carpi radialis, extensor carpi obliquus, medial digital extensor, common digital extensor, lateral digital extensor, in the ox all these muscles are innervated by the nerve, radial nerve, while in case of flexor nerve like pronator teres muscles is actually innervated by median nerve. Flexor carpi radialis also innervated by that branches of median nerve. Okay, flexor carpi ulnaris actually innervated by branches of ulnar and median nerve, while ulnaris lateralis is innervated by branch of radial nerve. Okay, superficial digital flexor muscles is innervated by branches of ulnar and median nerve. Okay, and deep digital flexors also innervated by branches of median and ulnar nerve. Okay, and if we see that the superficial digital flexure, deep digital flexure, and flexure carpi ulnaris, these three muscles are actually innervated by both ulnar and median nerve, while ulnaris lateralis innervated by radial nerves, and two muscles like pronator teres and flexor carpi radialis are actually innervated by branches of median nerve. Okay. Questions number 23. The flexor carpi ulnaris and ulnaris lateralis muscles are inserted on the dash carpal bone. Option A, accessory carpal bone. Options B, first carpal bone. Option C, third carpal bone. Option D, intermediate carpal bone. The right answer is option A, that is accessory carpal bone. Okay. The flexor carpi ulnaris and ulnaris lateralis muscles are actually inserted on the accessory carpal bone. Okay, let's see the muscles of forearm along with their origin and insertion point. Okay, there are two type of muscles on the forearm we can found. That's extensor muscles and flexor muscles. Okay, extensor muscles like extensor carpi radialis, its origin point is crest of lateral condyle and coronoid fossa, while inserted in metacarpal tuberosity. Second is extensor carpi obliquus, is origin point is anterior lateral surface of radius and lateral border of ulna, inserted at that upper end of the metacarpal bone at the posterior medial aspect. Third extensor muscles is medial digital extension. It's originate at coronoid fossa of humerus, inserted at second and third phalanges of medial digit. Okay. Fourth extensor muscles, common digital extensor muscles. Its origin point is lateral epicondyle of humerus and lateral border of ulna, inserted at extensor process of the concerned third phalanx. Last extensor muscle is lateral digital extensor muscles, which is originated at lateral aspect of proximal end of the radius and lateral aspect of the radius and ulna, inserted at second and third phalanx of the lateral digit. Okay. Second group is flexor muscles. That pronator teres muscles originate at medial condyle of humerus, inserted at upper third of medial surface of radius. Okay. Flexor carpi radialis muscles originate at medial condyle of humerus, inserted on the nodule at the posterior aspect of proximal extremity of large metacarpal bone. Flexor carpi ulnaris muscles originate at there is a two origin point, medial condyle of humerus and medial aspect of olecranon process of ulna, while inserted at accessory carpal bone. Ulnaris laterally muscles originate at lateral condyle of humerus, inserted at accessory carpal. Superficial digital flexor muscles originate at medial condyle of humerus, inserted at second phalanx. Deep digital flexors originate it has three origin point, that is olecranon process of ulna, medial condyle of humerus, and posterior surface of radius while inserted at third phalanx. Questions number 24. The medial deep volar metacarpal artery is the continuation of the dash artery in the ox. Option A radial, option B median, option C ulnar, option D brachial. The right answer is option A, that is a radial. Okay. The medial deep volar metacarpal artery is the continuation of the radial artery in the ox. Okay. Actually, that medial artery is the continuation of the brachial artery after it detach the interosseous artery. Then it passes downward along the posterior medial aspect of the radius along with this median nerves, and then it divides into that radial and ulnar artery. Okay. This radial artery also goes along the posterior medial aspect of the radius, and it reaches the posterior surface of the carpus, and it's continuous volar medial metacarpal artery. Okay. While ulnar artery is the main continuation of this medial artery, and its descent down and ultimately form volar common digital artery, which also divide into two volar proper digital artery at the level of distal part of first phalanx. Question number 25. The internal pudic artery in ox divide into two branches, that is dorsal artery and dash artery of the penis. Option A deep, option B ventral, option C superficial, option D median. The right answer is option A, that is deep. Okay. The internal pudic artery or pudendal artery, which is one of the terminal branch of the internal iliac artery in ox, is divided into two branches, that is dorsal artery and the deep artery of the penis in case of male. While in case of female, this internal pudic artery, after providing muscular and rectal branches, it's supplied to the vagina, vestibules and vulva, and the terminal continuations passes beyond the scale arch and ramify in the clitoris. Questions number 26. The puncta lacrimal are in trans of the two dash duct. Option A lacrimal, options B optic, option C nasal, option D occipital. The right answer is option A, that is a lacrimal duct. Okay. The puncta lacrimali are the entrance of the two lacrimal duct. Okay. The puncta lacrimali is a small hole which is actually present in the eyelid that drain tear to the nose. Questions number 27. The pancreas in ox is irregularly quadrilateral in the form and lie almost entirely to the dash side of the median plane. Option A right, options B left, option C median, options D anterior. The right answer is option A, that is right. Okay. A pancreas in case of ox is irregularly quadrilateral in shape and lie almost entirely to the right side of the median plane. Okay. While in case of a horse, that pancreas is roughly triangular in shape and is situated transversely at the dorsal portion of the abdominal cavity, mostly also the right side of the median plane. In case of dog, that pancreas mainly consists of two branch, left and right, and both part meet together behind a pylorus and form a V-shaped structure which extend caudo-dorsally mostly up to the corresponding kidney. Okay. In case of a pig, that pancreas is triangular in shape. Okay. In case of fowl, that pancreas elongated, slight lobulated, yellowish red colored gland which is located between ascending and descending part of duodenum. Okay. Questions number 28. The trochlear nerves may be seen emerging between the dash and the cerebral hemisphere. Option A cerebellum, options B pons, option C medulla, options D none. The right answer is option A, that is cerebellum. Okay. The trochlear nerves may be seen emerging between the cerebellum and the cerebral hemisphere. That is actually it emerges from posterior or dorsal aspect of the midbrain. Questions number 29. The facial nerves which passes outward in front of the eighth cranial nerves and enter the internal acoustic. Option A meatus, options B foramen, option C muscles, options D group. The right answer is option A, that is meatus. Okay. The facial nerves passes outward in front of the eighth cranial nerves and enter the internal acoustic meatus. Questions number 30. Dash is the largest bone of the hock joint. Option A, calcaneus. Options B, fibular. Option C, os calcis. Options D, both A and B. The right answer is option A, that is calcaneus. Okay. Largest bone of the hock joint, that is calcaneus bone. If we see that's hock joint is actually a compound joint. It's mainly consists three types of joint. That is a tibia and tarsal joint, that's tibio-tarsals articulations, and there is a tarsals which articulation, that's intertarsals articulations, and there's a tarsals and metatarsals articulation that is known as tarso-metatarsals articulation. Okay. And if we see that's bone which is mainly involved in hog joint, then we found there's a distal end of the tibia, there's a tarsals bone, there's also lateral malleolus bone, and there's a proximal end of the metatarsals bone. Okay. And if we see that's movement, then tibiotarsals articulations has extension and flexion movement, while other articulation has gliding type movement. Okay. That's much for today. Thank you.